We know that we can't prevent transmission of this virus from everybody who's out there right now who has it. So there's been exposures in the past 14 days where people are starting to get sick. What we're trying to do, of course, in the community is stop those transmissions and decrease them. But there are people out there right now who are incubating. So we know there's going to be more cases identified over the next week to 14 days. What we want them to come in a trickle, not a flood. And that's what we're working on very carefully. And we know that it's different geographically in different parts of the province and parts of the country. So some parts of the province, it's still introductions from other places, and we're able to manage them. In the Lower Mainland, in Vancouver Island, there's community transmission that is driving what we're seeing right now. So that's one of the really important reasons why we have these community measures in place. So what we want to do is make sure that as people are going into hospital, into ICU, that we're able to manage the load so that as people recover and get out of hospital, those beds become available for others. We have seen, and we'll talk about it later this week, in other countries that sometimes it can rapidly increase the number of people who are infected. So that's what we're holding our breath on right now. Every day we're getting more cases. Every day we have more people who are going into hospital. But the measures that we're doing on a community basis and continuing the testing and the management of clusters and outbreaks in individual cases in the community is what we're trying to do to break all of the chains of transmission, to keep the people who are getting sick with this at a trickle that we can handle in our system. If that doesn't work, we need to plan for the worst, which is making sure that we have lots of capacity. We have both the beds, the ventilators, and importantly, the people who are able to manage people through that over the next coming weeks to months.
Yeah. Just to say that it's not over 4,000, it's 3,866 available beds. That's based on, those are March 24th numbers, so they're today. And what that indicates is preparation. And I think it was a necessary preparation, but it was a very, very difficult decision that Dr. Henry, that the work that we've done and the modeling we've done prepared us for, which is to prepare the capacity we need and the supports and the training we need for healthcare workers, from doctors to care aides who might well be doing different things during this outbreak. So this is preparation. And you're going to see some later in the week, as Dr. Henry has said, some of the modeling that this is based on. But essentially what we're doing now is ensuring that to the maximum extent possible, we're not caught short. People they've asked this question repeatedly, which is, do we have enough? Well, that will depend at least in part on our collective efforts to be 100% behind the measures ordered and proposed by Dr. Henry. So we all have a role in that. But what's happened in our hospital system over the last 2 weeks is unprecedented. I don't think we've ever seen these levels of occupancy, which means that these low levels of occupancy, and it's because we're preparing and understanding that we have to be prepared for the possible influx of patients. Everything we do in the community, though, from all the work being done in virtual health, all the work being done by people taking samples, by all the work being done by testing, is to, as Dr. Henry suggests, limit the number of people at any given time come in and allow, of course, other people to recover. And we're heartened, and I'm certainly heartened to get the news that a very significant number, 28% of people diagnosed, have now recovered, which shows that there is not just a growth here, but there is a growth and a diminution that can happen if we continue to do our work. But for the next little while, I mean, you can see what we're doing, how we're acting, by preparing hospitals and by having many empty beds right now. It tells you that we are preparing for a much more difficult situation, and a much more difficult situation is pretty much inevitable.